What's going on, everyone? Happy Tuesday. Hopefully, everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for the viruses. It is time now for the Tuesday edition of the Virus Update for Tuesday, July 22nd, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, and you need to be informed of what's going on with these viruses. Want to stay informed with these viruses? Subscribe down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Alrighty, we do have a few things to look at today. I think we're looking at a 10 to 15 minute video. Let me take 10 to 15 minutes of your time, and I will let you know what's going on today. Starting off with Dennis, the COVID info guy, with his New Zealand weekly COVID update from July 14th through to July 20th. In New Zealand, they were reporting 593 new cases, or down by 21.1%. This is for COVID. Reinfections of COVID, 343. That's 57.8% of the cases. Deaths, 9, down by 50%. Total deaths, 4,743 since the pandemic started. That's up by 9. In the hospital, 77. That's actually down by 11.4%, which is some good news. Reinfections were once again 57.8%. However, sometimes there's deaths that are other reasons, or they don't know if COVID is what caused the death. Well, that makes the total today 19. One person was in their 50s, 2 were in their 60s, 6 were in their 70s, 7 were in their 80s, and 3 were in their 90s. Notice how the majority of these are older people, but even some people in their 50s can still die. And yes, though not seen here, any age could still die from a COVID infection. Now moving on to more stuff from Dennis COVID Info Guide. This time, Queensland Weekly Respiratory Surveillance Report from July 15th to July 21st, 2025. Reported cases of COVID, 1,195, that's down by 3%. Influenza, 3,650 cases, that's up by 10.1%. RSV, 921 cases, up by 14.4%. Hospitalizations, 147, down by 2.6%. Influenza, 195 cases, that's up by 7.7%. RSV, 52 cases. That's up by 13%. So there you go. You can see that over in Queensland, it looks like COVID may be peaking. Influenza is still being stubborn, and unfortunately, it is still rising. And though COVID may be peaking in Queensland, you know what? Australia is still having a problem. Hundreds of aged care facilities are facing COVID-19 outbreaks amid renewed vaccination calls. Yes, more than 200 aged care facilities are facing active COVID outbreaks, but authorities say numbers have hit the peak and begin to decline. So looks like that may be beginning to decline. Since the beginning of June, 138 care residents have died due to COVID-19. The health department has recorded. This is over in the Australia. So, yeah, that's not some good news. All right, moving on to this, just a quick reminder about long COVID, or maybe you didn't know this. This is education for you if you did not know this. Long COVID doesn't just pose a threat to personal well being, it impacts families, communities, and the national economy. Think of it this way: you live in a household. Okay, it's summertime. Your kid gets COVID at summer camp, brings it back to the household. Okay? Uh, Everyone ends up testing positive, gets it. One person, maybe it's the member in the family that brings home the most money. Maybe it's the father, maybe that's the mother. You know, these days, who knows? Um, Guess what? Say you don't recover and you're going to get long COVID and, well, you can't work anymore. Now the breadwinner of the family can't work anymore. Guess what? Why am I saying this? It happens. It's real. It's costing money. In some cases, people are having to sell their houses. Let's keep reading here. Recent estimates show it sidelines millions of workers, cost trillions in lost productivity, and quietly reshaping the U.S. labor market and economy. Yeah, you don't hear much about this on the news, and many just watch the news and take it at face value. Oh, well, the news just said, well, if the news didn't say anything, I guess it's not happening. Guess what? They're not saying anything, but it is happening. This is real. I mean, not only does the breadwinner in the family, if they go on to get long COVID, stop bringing home the money, guess what? Suddenly the company they worked for, or maybe they were self-employed, whoever, suddenly, guess what happens? Yeah, that company just lost one of their workers. Maybe you own your own business. Maybe you are a doctor. Long COVID doesn't discriminate. It hits anyone and everyone. Maybe you were a doctor and go on to get long COVID. Guess what? And you can't treat your patients anymore. This happens. Haven't seen many stories of it, but it does happen. Suddenly your patients need to find another doctor. And some people say, oh, he was my favorite doctor. I really loved going to that doctor. Yeah, suddenly they have to look for a new doctor. I mean, it's hitting healthcare really hard. Doctors, nurses, physicians, physical therapists, specialists, you name it. It is hitting people hard. 35 million adults in America are dealing with long COVID. Job loss, mental health, big time. The stress of what comes with a household dealing with long COVID is huge. I mean, long COVID's expensive, not only in the fact that you may lose your job, but then you got to pay for the treatments, all the specialists you have to see. Trust me, I've seen several specialists. $3.7 trillion it's costing the United States. And they're looking for ways to save money. Here in the United States, you know this. We're not going to talk about Doge, but you get where I'm coming from. They're trying to save money in the United States. Here's a big way you can save money. Treat long COVID. Do something about it. It's a really bad thing, and nobody wants to talk about it. Nobody wants to put an end to it. It's ridiculous. Something else that's ridiculous. Japan, whooping cough. Week after week we talk about this. It's continuing to get worse. Whooping cough cases in Japan hit new high for fourth straight week. Weekly cases of whooping cough in Japan have hit a new high for the fourth straight week. The Japan Institute for Health Security says medical institutions across the country reported, here you go, can you believe this? Another 3,682 patients in the week through July 13th. That was 104 more than the previous week. Yeah, whooping cough cases continue to go up. Japan has 48,073 whooping cough cases so far this year. All right, I just gave you some bad news. Let's take on a little bit of a lighter note now. I'll give you a little bit of better news. Belize government announces that they have contained measles outbreak. Okay, this is some good news. They're saying that their measles have slowed down. They've got it under control. Well, guess what? I'm going to show you somewhere else where I wouldn't say it's completely under control, but we haven't seen any new cases. And that today, my friends, is Texas. Texas reports 762 new measles cases. And I have a sticky note here. Can you see that? I put on there no change because I went back and watched last week's video on Tuesday, and it was also 762 cases. I refreshed this. It even says July 22nd, which is today's date. So there's no change in Texas today for measles. That is some good news. Now, we got to get back to some bad news. Here's the air quality map of the United States. Take a good look at this. Yeah, you see some purples in Canada. You see some yellows and oranges snaking their way down to the mid-Atlantic. Good up here in New England where I'm at right now. Still in Maine. Going home next Wednesday. We can see northern Florida panhandle, a little bit of yellow. Some minor problems on the West Coast. Not good. If you have COPD, if you have asthma, or anything else that could impact breathing, please take that seriously. You can see just update here. Oregon and Washington, you have a little bit of problems. California, few problems there. Not as widespread. Looks like the mountainous areas may be okay. Pinellas County, Florida, you got a problem. Look at all these EMS calls. Sick person showing up multiple times, several other things. Summertime in Florida. What can I say? What more can I say? All right, let's see if we do have the update from Philadelphia for yesterday. This may not load. We're looking for Philadelphia EMS calls. If it doesn't load, that's okay. I don't know. We had to reboot the browser just before we started. It happened at random just before we started this video. Here we go. Monday, 804 EMS incidents in Philadelphia. And as you know, I like to retweet this or repost it, as we say nowadays. I wish X was just still called Twitter, but I get it. He changed it because he also has another company called SpaceX. Whatever. We won't go there. Taking a look at Montgomery County, Pennsylvania. Currently, there are 14 calls. Respiratory emergency is listed. And I suspect we may start to see more respiratory calls pretty soon. Why is that? Well, as you know, it is Tuesday. First off, here's Chester County. You see a maternity labor pain. It says pain. That's not good. Are they having the child now, or are they having problems? Ooh, that's I don't know. Heat exposure, heat-related illness. All right, it's Tuesday. It's Pennsylvania Day. I got some bad news. Yeah. First off, XFG is dominating in Pennsylvania. You knew that. It was dominating last week. But now let's take a look at what's going on with the COVID levels in Pennsylvania. And apologies if you cannot see this. I'm hoping you'll be able to see this. Yeah, you can see this. It's different than when I do these videos, data-filled videos from home. Yeah, take a look here. Pennsylvania COVID levels. They are starting to go up, and that's a pretty significant increase. Now, it's still in low. Once it gets above the value of 3, that's when it goes to moderate or greater. And right now we're at 2.64. Do another rise like this next week. Pennsylvania is going to be back to moderate levels of COVID. And I also wanted to show you what's going on in Warminster, Bucks County. Can't get it for some reason. That's okay. Warminster, Bucks County is now rapidly rising for COVID. And that is a populated area. I work in that area quite often. Concerning to see. So Pennsylvania has joined the COVID is rising party. Yikes, not good. Also joining the COVID is rising party would be New York State. I don't care what the cases show at this point. All right, 311 new cases. The hospitalizations just tell us right here alone. You can see here, we're starting that staircase now. And we have staircased even higher in New York State. 261 new total people hospitalized, 17 people in the ICU at this time, and that's an increase from last week, which was 235. It's going to take a moment for this to load. Let's also take a look at Long Island while we're waiting for that. Oh, actually came up faster. Let's pause and take that hydration break. Juice is my drink of choice for today. Alrighty, doesn't that taste or feel much better? And oh my, look at Long Island. I forgot to look at this myself before the video, and I really wanted to look at this. So it was 43 people in the hospital. Now it's up to 53. The number in the ICU is up to 5. And we might as well look at the most populated part of New York State, which is New York City. And New York City is just one higher than last week on Tuesday. 120 in the hospital and 10 people in the ICU. The ICU number is actually down a little bit compared to last Tuesday, but nonetheless, yeah, it's safe to say New York State summer COVID wave is starting to hit you. All right, taking a look at emergency department visits diagnosed with COVID, we can see they are rising across the United States. We got a request yesterday for an area, and I believe it's near Sandusky, Ohio. So that's where we're going to look. Can I do a wastewater report for there? Well, we're going to do a couple things for Ohio, maybe somewhere else as well. Right now, COVID in Sandusky, Ohio, apparently there's a Six Flags near there. That's what I was told. Is low at this time. I suspect it's not going to stay that way. Probably at least between now and August, it will start rising. Let's go over to wastewater scan. This was the Ohio dashboard. Everything's great out here. I wish they used a color code. I mean, maybe everywhere's low on that map. I don't know. Maybe it hasn't updated. Take a look at this. Wastewater scan. What are you seeing new here? Yeah, orange across the entire country. Now, there's a reason for that. The chart did one of those wonky movements at the end. I don't really think every single region is high. Northeast is probably not yet. Although, you see here we have multiple wastewater sites high. But you also see this. We just mentioned Ohio. And the Akron, Ohio, and Youngstown, Ohio are both coming up high now. So let's go to Akron, Ohio. And this is a little bit better of an update. And oh my, take a look at this. 1 update, 2 update, 3 updates. You know the deal. If I had a red X, I'd put it there. This will likely get corrected, but you get the idea here. Things may now be starting to rise in Ohio. Things may not be staying low anymore. Let's go back to the map, shall we? Because we want to take a look at somewhere else. Let's go somewhere out on the West Coast now. How about if we can, let's do an update on what's going on in Las Vegas, Nevada. Have they started to rise yet? You know, every time we put the radio on, whether we're going to the grocery store, every time the radio's on, I feel like I'm always hearing about someone's going to be starting their residency in Las Vegas. And I just heard about someone. Maybe it was the Eagles. Maybe that's the group that I was hearing about. I don't know. But let's see. How risky is it for them to do that right now? Okay, so something different here in Nevada. You can see things did rise there, but then they kind of started to drop a little bit. Look at that. Maybe starting to drop. But again, that's 2, 3, 4 movements. We'll have to see if that gets corrected. I hope that holds to be true. Let's check one more region. Let's go down to where a sea of COVID is right now. You know where I'm talking about. That is Florida. And let's see, are we still dealing with high levels of COVID in Florida? And we're not even going to click on any of the sites. We're just going to click on COVID. Wow, look at this. So there's just one. Well, you got Tallahassee that's not updating. You just have one site that's not orange. You are swimming in COVID in Florida right now. Normal for this time of year since the pandemic started. Hopefully, this will be one of those years where August comes and, well, Florida starts to drop. Because, again, folks, I do not see any future variant for after XFG. I don't know what that's going to be. Hopefully, I can figure that out soon and we can start, getting some tiny bits of information here and there. So, you get the point. The summer wave is here in the United States. It's getting worse. It's starting to spread into more areas. Pennsylvania is now rising. New York State hospitalizations clearly trending upward each week, though be it they were higher at this time last year. It's trending in the wrong direction. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. I will see you again tomorrow. If you like today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. Ways to support the channel are down below. Until I see you again next time, stay safe, everyone. Have a fantastic Tuesday afternoon. Thanks for watching.